There's a new trend in medical care that's popping up across the state: freestanding emergency rooms. News 3's Kristen Gilfus tells us how those ERs are helping to solve a growing problem.
And the big problem is there's just not enough emergency rooms for the patients that need emergency care.
The American College of Emergency Physicians acknowledged the problem in its latest state-by-state report card, giving Texas an F grade for access to emergency care. In hopes of solving that problem and giving us all more options, Texas now allows freestanding emergency rooms. It's the first state to do so. In some ways, they're the same as the ERs attached to hospitals.
Well, both provide emergency care and both have good people working in them.
But they're different in the fact that they're independently owned. Dr. Andy Wilson and Dr. Lon Young opened their independent facility, Caprock ER, in South College Station about a year ago.
The ability to have greater access, greater capacity in the system is not only a public health concern, but you as an individual know that you can go and get immediate care when it's your unfortunate time that you have an emergency.
Ever since Texas passed the law allowing these freestanding emergency rooms, they've been popping up all over the state. In 2011, there were just 25 of them. Today, nearly 150. And the doctors here at Caprock say expect to see plenty more in the future.
I think there will probably be 5,000 to 6,000 of them in the country before the end of the next decade.
Dr. Jane Boland with Texas A&M School of Public Health has been researching these new freestanding ERs. She says there's one place in particular they need to be built.
Rural areas are historically underserved in terms of the availability of medical care, and it costs more to run a hospital in a rural area, but to have emergency care out in those areas where they perhaps need it more than others.
Dr. Wilson at Caprock couldn't agree more.
And operators that operate in the freestanding ER space like us and others can joint venture with hospitals to manage and run those ERs like a freestanding ER, and I think that's a model that will work, and that's what we're seeing in some other states.
In College Station, Kristen Gilfus, News 3.
You will be seeing at least one more freestanding ER in the Brazos Valley soon. Details are still being finalized, so they're not releasing the location just yet. But Caprock ER is opening another facility by the end of the year.